Academic detailing first got its major claim to fame about 20 or 30 years ago by Dr. Avorn from Harvard, and he at the time tried to devise a mechanism by which pharmaceutical representatives, the information that was being provided by them could be countered, hence the term counter detailing or academic detailing, by people who theoretically did not have a vested interest or ulterior motive in sales, and really tried to balance out the information that was being provided by sales with information that perhaps was supposed to be more biased and unabashed. There will absolutely be a move more toward academic detailing now with the passage of the stimulus package and in the healthcare law last year. There's already been millions of dollars that have gone to companies to foster or promote this type of academic detailing through government-based employees. That will be physicians and pharmacists and other medical professionals that the government will employ to tout what it thinks is the information that we as physicians are missing. The government undoubtedly has a vested interest in this, being the nation's largest payer. Of course, the ulterior motive is to save money. The pharmaceutical industry has specific regulations imposed on it by government and other regulatory agencies, and the real issue, I think, is that these government employees can say or pretty much do almost anything in terms of the information that they provide. I think that academic detailing, I think its goal is really to counter incorrect information from getting out there, but much like communism on paper, I think the application of that process is really where we need to focus. Of the states that have models like this in place, and I'm familiar with about half a dozen of them, I don't think anybody has done it perfectly. Each one has benefits and disadvantages. I think they all are making the college try, if you will, at trying to do it properly, but I don't think anybody has successfully done it the way that it probably should be done. You know, the government impetus is not to provide care to patients. The government cares about saving money. If providing quality care to patients is a secondary gain, then they're happy to tout that, undoubtedly. But make no mistake about it that the government is in the academic detailing business to drive pharmaceutical costs down by pushing people to prescribe the cheaper alternative. The question is whether that's safe and effective. I think that still remains to be seen. I'm a believer in the concept of academic detailing, but I think that everybody needs to play by the same rules, that there needs to be a level playing field. And if there are regulations on the industry in terms of what they can say and what they can do and how much money they can spend on a pen, then those exact regulations need to apply to the government employees. Or we can go to the Wild West and relinquish regulations on everyone, and then people can go and say and do whatever they want. I think it'll probably be the former. The question is, who is going to monitor the government?